My name is Ana Ricardo. I'm a nephrologist and associate professor in the Division of Nephrology, Department of Medicine at the University of Illinois in Chicago. We know from prior studies that sleep apnea is very common in patients with chronic kidney disease, with an estimated prevalence up to 50% in patients who have end-stage renal disease on hemodialysis. And we have found that there are different mechanisms by which sleep apnea could have an effect in the kidneys. For example, patients with sleep disorder breathing, the most common of which is sleep apnea, have activation of the sympathetic nervous system, which will lead to hypertension, which is one of the most common risk factors for chronic kidney disease. In addition, patients with sleep apnea have disorder in their appetite and therefore are more prone to develop obesity, as well as insulin resistance, which is one of the risk factors for diabetes, which could also lead to chronic kidney disease. We are currently planning a study in which we are going to evaluate how sleep disorder breathing, and in particular sleep apnea, may impact chronic kidney disease progression in adults. We are planning to recruit 2,200 individuals who are currently enrolled in the Chronic Renal Insufficiency Cohort, or CRIC study, which is an NIH-funded multi-center study of risk factors for chronic kidney disease. We will conduct a home sleep assessment during one night to ascertain whether individuals have sleep apnea, and then we will follow these participants for up to 5 years, during which we will study whether having sleep apnea is associated with progression of chronic kidney disease into end-stage renal disease requiring dialysis or kidney transplantation, as well as the impact of sleep apnea on cardiovascular events such as myocardial infarction, stroke, peripheral artery disease, and arrhythmias. The results from our study will shed light regarding potential treatments for chronic kidney disease progression and cardiovascular disease in patients with CKD. For example, if we find that sleep apnea is significantly associated with worsening of chronic kidney disease, we may study whether treatment of sleep apnea with CPAP may help patients with chronic kidney disease slow down their disease progression. The MD-PhD program at UIC provides a great opportunity for students who are interested in an academic physician-scientist career, because it provides the opportunity to work in different laboratories and with different specialties and develop a research career in a very broad area of medicine.